I invite you to watch a short educational video showcasing the procedure of checking a patient's blood sugar. The purpose of the test allows us to assess the effectiveness of treatment. The results of the measurement allow us to modify the diet or the treatment in order to equalize diabetes. Good morning, Miss Jane Smith?
Yes.
My name is Julia, I'm a nurse, and I would like to take some blood from you in order to check your glucose levels. Is that okay?
That is fine.
Okay. I would like to go wash my hands, and then you will wash your hands afterwards, okay?
Yes.
The required equipment is non-sterile gloves, a lancet, a glucometer, the glucometer strips, sterile gauze, and a kidney bowl for any waste. So I'm going to prepare my glucometer. Open my sterile gauze. Where's there? I'm going to put on my gloves. Take my lancet. Could I pass me your hand, please? Wipe away the first drop. And we use the second drop. And secure the area. Hold there, please. Your result is 92, so within the norm. Okay.
Thank you.
Thank you.
Good.